This second speech is going to be a bit different to my first speech. It's also going to be touching on mental health, but it's going to be taking a more institutional look at how the European Union deals with mental health. So, if you are ready, I will begin. Dear colleagues, hello again. As I was saying, this second speech is going to be quite different to the first one, but it is going to be touching on mental health like the first one. Essentially, I was quite curious to know what the European Union is doing in the realm of mental health. So I went on the European Commission's website and I found some very interesting statistics and details which I'd like to share with you this evening. First of all, I came across a report dating back to 2018. And according to the report, 84 million people in the European Union are affected by mental health problems. And the total costs of mental ill health are at 4% of GDP across the 28 member states. So essentially, poor mental health costs the European Union 600 billion euros every year. And that's 4% of the European Union's GDP. I then scrolled further down on the European Commission's website, and I wanted to look at what the European Commission is currently doing by way of mental health support. So the Commission is currently looking at different ways to support the mental health of Ukrainian refugees and Ukrainian displaced people. So that's what's going on currently. The European Commission has put together some online courses and some online training material aiming basically to support migrants and Ukrainian refugees, particularly on the mental health side of things. So the European Commission set up a network called Migration and Health. The aim of said network is to train professionals to help migrants in many different areas of health, including mental health. This new network is called, and I quote, Supporting Ukraine, Neighbouring European Union Member States and Moldova. And this network aims to federate the efforts of healthcare professionals, bring these efforts together to support refugees and displaced people who are struggling with mental health problems in the wake of what they've experienced. This network is not just aiming to support people on the mental health side of things, it's a general health network, but nevertheless, one of the areas that it looks into is mental health. But that's not all. The European Union actually funds and supports a lot of different projects relating to mental health. Firstly, the European Union supports a project which targets schools and which aims to help migrants and refugees in 6 European countries. And the goal essentially is to bolster preventive school-based interventions as a way of promoting refugee and migrant adolescent well-being. The aim is also to implement said school-based interventions in different educational settings. So essentially what the project does is it trains teachers and helps them to identify the mental health problems that their students may be going through, and it helps them to respond effectively and support those students. There are other projects that the European Union supports and funds, and these other projects aim to, for example, find innovative solutions and provide particularly refugees and displaced people with high quality resources which will help them become more resilient. But what about COVID? Well, during the pandemic, DG Sante set up a dedicated network space on its health policy platform so that health and social stakeholder organizations could exchange specific mental health practices and knowledge related to COVID. So it just basically brought together these different health and social organizations so that they could at least start a conversation about the mental health solutions which are working, the mental health solutions which maybe are less effective, and anything else relating to helping people with their mental health during COVID. And the EU also basically set up a virtual network which focuses on the needs of vulnerable people, so particularly homeless people and people with pre-existing mental conditions who were suffering a lot during COVID. But what about past actions? What about the European Union's past track record in the area of mental health? Well, firstly, various policies and services have been made available for member states. But the thing is that actually mental health policies and services are usually the responsibility of individual member states, not of the European Union. Nevertheless, the European Union has found ways to support mental health efforts for quite a long time, and that's what I'm going to be focusing on for the remainder of the speech. In 2013, the Joint Action on Mental Health and Wellbeing was launched, and that ran until 2018. And what was this joint action? Well, the aim was to come up with a framework for action in the policy area of mental health. And the aim was also to build on previous work which had been developed under the European Pact for Mental Health and Wellbeing. The ethos here was really to promote mental health and well-being, but also to prevent mental illnesses and to improve mental health care across the Union. Essentially, the European Union wanted to have an impact on workplaces, so workplace mental health. They also wanted to have more of a far-reaching impact in schools and universities. But they also wanted to promote this cross-cutting focus. They wanted to develop community-based mental health care as well. And all of this seemed like an excellent idea and a much needed idea in the European Union at the time. Now, this joint action on mental health and well-being resulted in the European Framework for Action on Mental Health and Wellbeing. And this framework aims to support EU countries. It aims to help them as they review policies, as they share experiences in improving policy efficiency and effectiveness. And there are three stated aims here. So these are the three aims of the European Framework for Action on Mental Health and Wellbeing. The first aim is to develop early intervention programs, so really to focus on prevention. The second aim is to ensure a transition to comprehensive mental health treatment. And thirdly, the third aim is to strengthen best practices. But that's not it, that's not all. There is also an EU compass for action on mental health and well-being. And that actually helped implement the framework that I was just talking about. It helped implement this framework by communicating the joint action's priorities. So there was an online platform which was created, and this online platform was really useful and really needed because it actually facilitated the collection of information on mental health action. And it also facilitated exchange of information, analysis of information, analysis of best practices, etc., etc. What it also did was, this response meant that the EU could then monitor mental health and wellbeing policies and activities within the EU member states. So that they could identify best practices, and they could also collect data on different activities. So different responses that were working well, responses maybe that were less effective as well. And this EU compass for action on mental health and well-being resulted in various high-level forums being organized annually. And these forums were held in order to communicate the results of various surveys. But they were also used to assess the progress of member states in the area of mental health. And these forums also served as a springboard, if you like, for best practices. So that it meant that countries could exchange best practices. So essentially, the European Union, what it does in the area of mental health is it gets countries talking about mental health, and it puts mental health on their radar. But it also does more than that. It facilitates the finding and implementation of solutions through efforts to identify and promote best practices. And I think this is really important. Of course, mental health provision traditionally has fallen within the remits of the individual member states' competencies, but the EU isn't idle on this issue, which is very important and very impressive. It's just trying to get countries talking about mental health. It's trying to get countries to prioritize mental health and actually take action. In the case of the EU Compass that I was talking about, the EU Compass initiative joined up with an EU group of governmental experts and also non-governmental actors to prepare 4 annual scientific papers on issues relating to mental health. And also, mental health always has been a priority for the steering group on health promotion, disease prevention, and the management of non-communicable diseases. I'm sorry, I think I actually forgot to put that in the Excel file, so I'll just repeat that again. Mental health has always been a priority for the steering group on health promotion, disease prevention, and the management of non-communicable diseases. And essentially, the Commission presents a series of best practices to this steering group. And then what happens is the EU member states can then indicate which of these best practices they want to implement or scale up. But the EU's response doesn't even stop there, because the EU also funds and co-funds mental health system reforms in different member states. And these reforms are often focused on strengthening community-based services and client-centered services as well. So the EU really helps support and fund these reforms, which make the provision of mental health much more community-based and client focused. For example, the EU actually co-funds a suicide prevention program in Austria, but it also co-funds intervention programs to tackle depression in various different member states. I think Belgium may be one of the member states where the EU does most actually to fund projects of this kind. But then on a lower level within the EU, there's the Coalition for Mental Health and Wellbeing within the European Parliament. So what's interesting is that there are various MEP alliances for mental health. And the aim of these alliances and coalitions is to advocate for a more coordinated response on the part of the EU in the realm of mental health. So I know that I've thrown a lot of information and programs and proper names at you, but what can we say in summary? You're probably wondering, has this borne fruit? Has this been effective? Well, at the end of the day, you could say that the EU response on mental health is only as good as the response of the individual member states. After all, mental health provision does very much fall within the remits of the individual member states, not really and traditionally within the remits of the EU's competencies. But at the end of the day, all EU citizens live in EU member states. They have to. And since mental health mainly forms within the remits of member state competencies, the EU's response really is only as good as the member states' responses. For example, the EU can present best practices, but at the end of the day, if mental health care is not funded properly in member states, these efforts may not bear fruit. And the reality is that mental health services are chronically underfunded in member states. There are very long waiting lists for mental health care in most member states. There are variations, of course, between member states, but these are general trends, and there's a significant lack of funding in the vast majority of member states. And this is all against a backdrop of increasing mental health problems worldwide, not just in Europe, but worldwide. It's estimated that in the EU, 1 out of 6 people suffer from mental health problems. However, there are glimmers of hope here. For example, under the aegis of the French presidency of the Council, a ministerial conference was convened on mental health and on helping vulnerable young people with their mental health. And actually, this ministerial conference was interesting because it it really highlighted the problem of massive underfunding in the area of mental health in member states. So that was a glimmer of hope, the fact that the EU is pointing to this underfunding, sees it as a problem, and may well push member states to do more in the area of mental health. The other glimmer of hope is the fact that the EU put together a massive vaccination strategy and vaccination campaign during COVID. The EU really came up tops when it came to procuring vaccines and getting people vaccinated in the EU. And if they can do that in the face of a very unprecedented crisis, the hope is that they will be able to come together to produce a similar united response in the face of another pandemic, the pandemic of mental health problems. So I hope that you found it interesting and that I was less fast this time. And I think I will stop there, but I hope you enjoyed it.